Understanding hepatitis, an inflammation of the liver. Hepatitis is a serious medical condition that affects millions of people worldwide. It is characterized by inflammation of the liver, a vital organ responsible for many essential bodily functions. This inflammation can disrupt the liver's ability to filter toxins, produce bile for digestion, and store energy. Hepatitis can range in severity from mild, lasting a few weeks, to severe, becoming a chronic condition that can lead to liver damage, cirrhosis, or even liver cancer. The liver, often referred to as the body's powerhouse, plays a crucial role in removing harmful substances from the blood, digesting food, and storing energy. When inflamed, its ability to perform these vital functions is compromised. Understanding the importance of a healthy liver is paramount in grasping the severity of hepatitis.
Types of hepatitis, from A to E and beyond. Hepatitis can be caused by a variety of factors, but the most common cause is viral infection. There are 5 main types of viral hepatitis: A, B, C, D, and E. Each type is caused by a different virus and has its own unique characteristics in terms of transmission, severity, and long-term health effects. Hepatitis A and E are typically transmitted through contaminated food and water, while B, C, and D are spread through contact with infected blood or bodily fluids. In addition to viral hepatitis, there are also non-viral forms of the disease. These can be caused by excessive alcohol consumption, certain medications, autoimmune disorders, or metabolic diseases. Alcoholic hepatitis, for example, occurs when excessive alcohol consumption damages the liver. Non-alcoholic fatty liver disease, or NAFLD, on the other hand, is linked to obesity and diabetes.
Transmission routes, how hepatitis spreads. Understanding the different ways hepatitis is transmitted is crucial for prevention. Hepatitis A and E spread primarily through the fecal-oral route, meaning that the virus is present in the feces of infected individuals and can contaminate food or water. This typically occurs in areas with poor sanitation or hygiene practices. Hepatitis B, C, and D are spread through blood and bodily fluids. This can happen through sharing needles, unsafe medical practices, or from an infected mother to her baby during childbirth. It's important to note that not everyone infected with viral hepatitis will experience symptoms. Some individuals may be asymptomatic carriers, meaning they have the virus but show no signs of illness. However, they can still transmit the virus to others, highlighting the importance of screening and vaccination.
Section 4. Recognizing the symptoms: acute and chronic hepatitis. Hepatitis infections can manifest in 2 main forms: acute and chronic. Acute hepatitis is a short-term infection that typically resolves on its own within a few weeks. Common symptoms include fatigue, loss of appetite, nausea, vomiting, abdominal pain, yellowing of the skin and eyes, also known as jaundice, dark urine, and pale stools. Chronic hepatitis, on the other hand, is a long-term infection that can last for years or even a lifetime. While some people with chronic hepatitis may not experience symptoms initially, over time the virus can cause progressive liver damage, leading to cirrhosis, liver failure, or liver cancer. Regular medical checkups and liver function tests are essential for monitoring the progression of the disease and managing any complications.
Section 5. Global Impact, a Public Health Challenge. Hepatitis poses a significant public health challenge worldwide, affecting millions of people and straining healthcare systems. Viral hepatitis is a leading cause of liver cancer and cirrhosis, accounting for a substantial number of deaths globally. The World Health Organization estimates that hundreds of millions of people are living with chronic hepatitis B or C, with many unaware of their infection status. The economic burden of hepatitis is also substantial, encompassing healthcare costs, lost productivity, and premature mortality. Access to affordable diagnosis, treatment, and vaccination remains a challenge in many parts of the world, particularly in low-income countries.
Section 6. Prevention and treatment. Protecting yourself and others. Preventing hepatitis is crucial in reducing its global impact. Vaccination is highly effective in preventing hepatitis A and B. Maintaining good hygiene practices, such as washing hands thoroughly, especially after using the restroom and before eating, is essential in preventing hepatitis A and E. Safe sex practices, including using condoms, can reduce the risk of transmission for hepatitis B, C, and D. Using sterile needles for medical procedures and tattoos is also crucial.
Treatment options for hepatitis vary depending on the type and severity of the infection. Antiviral medications are available for chronic hepatitis B and C, aiming to suppress viral replication and prevent liver damage. Liver transplantation may be an option in cases of severe liver failure. Lifestyle modifications, such as maintaining a healthy weight, limiting alcohol consumption, and avoiding hepatotoxic medications, are essential in managing all forms of hepatitis.